Windsor University School of Medicine, St. Kitts. Department of Anatomy. Upper limb. Shoulder. The shoulder is the region of upper limb attachment to the trunk and neck. 1. A large muscle that arises from two heads flexes and medially rotates the arm. It is innervated by nerves arising from different chords of the brachial plexus. This is the A. Latissimus dorsi, B. trapezius, C. deltoid, D. subscapularis, E. pectoralis major. Bones of the shoulder girdle. Clavicle and scapula, which form the pectoral girdle, shoulder girdle. The proximal end of the humerus. Muscles. Shoulder region. Anterior axioappendicular muscles of the upper limb. Pectoralis major, pectoralis minor, subclavius, serratus anterior, pectoralis major and supply, medial and lateral pectoral nerves. Origin, clavicle, sternum, and upper 6 costal cartilages. Insertion, lateral lip of bicipital groove of humerus. End supply, medial and lateral pectoral nerves. Action, adducts arm and rotates it medially, clavicular fibers also flex arm, pectoralis major. Pectoralis minor and supply, medial pectoral nerve. Origin, 3rd, 4th, and 5th ribs. Insertion, coracoid process of scapula. End supply, medial pectoral nerve. Action, stabilizes scapula by drawing it inferiorly. Subclavius end supply, nerve to subclavius. Origin, 1st costal cartilage. Insertion, clavicle. End supply, nerve to subclavius. Action, depresses the clavicle. Serratus anterior and supply, long thoracic nerve. Origin, upper 8 ribs. Insertion, anterior surface of medial border of scapula. End supply, long thoracic nerve. Action, protracts scapula and rotates scapula. Paralysis of the serratus anterior winged scapula. Due to loss of innervation long thoracic nerve. When the serratus anterior is paralyzed owing to injury to the long thoracic nerve, the medial border of the scapula moves laterally and posteriorly away from the thoracic wall, giving the scapula the appearance of a wing. 2. All the following muscles have a relationship to the scapula. If paralyzed, which muscle results in winging of the scapula with inability to elevate the arm above the horizontal? A. Serratus anterior, B. Latissimus dorsi, C. Levator scapulae, D. rhomboid major, E. deltoid. Posterior axioappendicular muscles. The posterior axioappendicular muscles attach the superior appendicular skeleton of the upper limb to the axial skeleton in the trunk. 1. Trapezius. 2. Latissimus dorsi. 3. Rhomboid major and minor. 4. Levator scapulae. Trapezius end supply, spinal part of accessory nerve, motor. Origin, occipital bone, ligamentum nuchae, spine of 7th cervical vertebra, spines of all thoracic vertebrae. Insertion, upper fibers into lateral third of clavicle, middle and lower fibers into acromion and spine of scapula. End supply, spinal part of accessory nerve, motor. Action, upper fibers elevate the scapula, middle fibers pull scapula medially, lower fibers pull medial border of scapula downward. Injury of the accessory nerve, CN11. The primary clinical manifestation of accessory nerve palsy is a marked ipsilateral weakness when the shoulders are elevated, shrugged, against resistance. Latissimus dorsi end supply thoracodorsal nerve. Origin, iliac crest, lumbar fascia, spines of lower 6 thoracic vertebrae, lower 3 or 4 ribs, and inferior angle of scapula. Insertion, floor of bicipital groove of humerus. End supply thoracodorsal nerve. Latissimus dorsi action. extends, adducts, and medially rotates the arm. Injury of the thoracodorsal nerve. Surgery in the inferior part of the axilla puts the thoracodorsal nerve supplying the latissimus dorsi at risk of injury. With paralysis of the latissimus dorsi, the person is unable to raise the trunk with the upper limbs, as occurs during climbing. Levator scapulae and supply dorsal scapular nerve. Origin, transverse processes of first four cervical vertebrae. Insertion, medial border of scapula. End supply dorsal scapular nerve. Action elevates scapula, rhomboids minor and major. End supply, dorsal scapular nerve. Action, retracts scapula. 1. An 34-year-old man, bleeding from a stab wound in the neck, is brought to the emergency department. After the bleeding has been controlled, further examination indicates that her left shoulder is lower than the right shoulder. Which of the following nerve is most likely injured? A long thoracic. B. Dorsal scapular. C. Axillary. D. Suprascapular. E. Spinal accessory. 2. A 22-year-old woman sustains a traumatic injury to the axilla that severely damages the thoracodorsal nerve. Which of the following movements is most likely affected in this patient? A. Adduction. B. Flexion. C. Lateral rotation. D. Protraction. E. Supination. Scapulohumeral muscles. The 6 scapulohumeral muscles are relatively short muscles that pass from the scapula to the humerus and act on the glenohumeral joint. 1. Deltoid. 2. Tes major. 3. Tes minor. 4. Supraspinatus. 5. Infraspinatus. 6. Subscapularis. Deltoid end supply, axillary nerve. Origin, lateral third of clavicle, acromion, spine of scapula. Insertion, middle of lateral surface of shaft of humerus. End supply, axillary nerve. Deltoid. Action. Anterior part, flexes and medially rotates arm middle part, abducts arm posterior part, extends and laterally rotates arm. Testing deltoid muscle. The examiner resists the patient's abduction of the limb by the deltoid. If the deltoid is acting normally, contraction of the middle part of the muscle can be palpated. Injury to the axillary nerve. The deltoid is a common site for the intramuscular injection of drugs. The axillary nerve runs transversely under cover of the deltoid at the level of the surgical neck of the humerus. The deltoid atrophies when the axillary nerve, C5 and C6, is severely damaged. Deltoid atrophy. Tes major and supply lower subscapular nerve. Origin, lower third of lateral border of scapula. Insertion medial lip of bicipital groove of humerus. End supply lower subscapular nerve. Action adducts and medially rotates arm. Rotator cuff muscles. 4 of the scapulohumeral muscles supraspinatus, infraspinatus, tes minor, and subscapularis, referred to as the sit muscles, are called rotator cuff muscles because they form a musculotendinous rotator cuff around the glenohumeral joint. Supraspinatus end supply, suprascapular nerve. Origin, supraspinous fossa of scapula. Insertion, superior facet of greater tubercle of humerus. End supply, suprascapular nerve. Action, initiates and assists deltoid in abduction of arm and acts with rotator cuff muscles. Infraspinatus end supply, suprascapular nerve. Origin, infraspinous fossa of scapula. Insertion, middle facet of greater tubercle of humerus. End supply, suprascapular nerve. Action, laterally rotates arm and stabilizes shoulder joint. Tes minor and supply axillary nerve. Origin, middle part of lateral border of scapula. Insertion, inferior facet of greater tubercle of humerus. End supply axillary nerve. Action laterally rotates arm and stabilizes shoulder joint. Subscapularis end supply, upper and lower subscapular nerves. Origin, subscapular fossa, most of anterior surface of scapula. Insertion, lesser tubercle of humerus. End supply, upper and lower subscapular nerves. Action, medially rotates and adduct arm. Rotator cuff injuries and the supraspinatus. Trauma may tear or rupture one or more of the tendons of the sits muscles, that of the supraspinatus is most commonly involved. 1. Which of the following muscles listed below is the rotator cuff muscle involved in medial rotation of the humerus? A supraspinatus. B. Subscapularis. C. Infraspinatus. D. Teres minor. E. Teres major. 2. A 31-year-old man is unable to raise his right arm above his head 3 weeks after dislocating his shoulder in a football game. Examination shows absence of rounded contour of the shoulder. Which of the following nerves was most likely injured? A. Musculocutaneous. B. Median. C. Axillary. D. Ulnar. E. Radial. Gateways to the posterior scapular region. Arteries and nerves associated with gateways in the posterior scapular region. Quadrangular space, superior border, teres minor inferior border. Teres major. Lateral border. Surgical neck of the humerus. Medial border. Long head of triceps. Contents. 1. Axillary nerve. 2. Posterior circumflex humeral artery. Quadrilateral space syndrome. Quadrilateral space syndrome usually happens from overuse, especially with overhead sports like throwing and swimming. The syndrome can also be caused by an injury, like a shoulder dislocation. Triangular, upper, space. Lateral border. Long head of the triceps. Upper border. Teres minor and subscapularis. Lower border. Teres major. Contents. Circumflex scapular branch of the subscapular artery. Lower triangular space. Medially. Long head of the triceps brachii. Laterally. Shaft of the humerus. Superiorly. Teres major. Contents. 1. Radial nerve. 2. Profunda brachii artery.